Operation Theatre, chapter 34. It's on page number 228, those who have the textbook. So, Operation Theatre. An operation theatre or operating room or a surgery suite, okay, is a room within a hospital which surgical operations are carried out. Here, the surgical operations are carried out. And this entire surgical suite, it has its own room, hallways, workroom, storage, front desk, okay. Every operation theatre complex has all these areas to itself. So sometimes we call it as an OT complex because it has its sub room, sub wards, okay, workroom, separate storage room, hand washing zone, front desk, separate reception, okay. So aims of planning an OT, when you are planning an OT, make sure your plan has area for high degree of asepsis, okay, to promote high degree of asepsis, ensure maximum safety to your patients and staffs who are working in the OT. You have to ensure maximum utilization of the OT, okay, which means do not shut the OT complex for long hours because they create a lot of profit for the hospital. Okay, any operation theater, it creates a lot of profit, a lot of income revenue is generated in the OT. Okay, so make sure you make your OT, your the number of OT you will have, the number of wards you will have. Make sure it is in such a way that a lot of income can be generated. It can be utilized as much as possible. Ensure maximum comfort to the surgical team, places to rest. Okay, uh, good ambience, paint that is cooling to the eyes and mind. Okay, so this kind of comfort you have to, noise free, sound free zones, air conditioned. Okay, considering long hours of work and all that too in a difficult posture, so make sure it's a very comforting environment you have in your OT. Provide complete environment control as well. Okay, your OT should be able to provide complete environmental control to you. Flexibility of uses and operating suits, how flexible it is for you to use the operating suits, in the sense each OT complex can be used for different specialties. Okay, some OT complexes are designed in such a way that only cardiac operations can be carried out, only ortho can be carried out, only ophthalmo can be carried out. Okay, so there is a lack of flexibility in specialty based OT. But if your operating theaters are flexible in nature, any specialty during emergency, any specialty operations can be carried out. If it's that flexible, it is way more convenient. Okay. Criteria for planning OTs. First is the environmental planning. You have to provide a safe environment for the patient as well as for the staff who are working in the OT. Economic criteria, optimization of interpersonal relationship between financial areas and operating departments. That should be like no loss that should be accumulated by the OT complexes. Workflow criteria, the flow of patients, how the patient is moved in and out of the host or OT, how the staffs moves in and out of the OT, the CSST supplies, sterile supplies, dirty supplies, linens, okay, other documents, how it moves in and out of the OT, that is a workflow criteria. It should be very smooth without any obstacles. Functional criteria, it should be or the design of the OT should be in such a way that it should follow a U function, a V function, or a linear function. Okay, it starts at one point, ends at the other point, and the movement, the direction of movement should be linear. It should like not too much of back and forth should be there. Okay, back and forth kind of a movement should be avoided in the OT. Okay. So these are the criteria of planning. Next, we have the physical facilities. Okay, the location of the OT. The best location of the OT is the one which permits a convenient and uncomplicated flow of patients, staff, and also the clean supply traffic. Okay, if there is no hassle in this movement, it means you have an uncomplicated flow. Okay, when things are uncomplicated, it's easy. The ease of use can increase your customer satisfaction as well. And it should be close to the surgical wards and ICU as well. Wherever you're planning your OT to be, it should be very close to the ICU department as well as the post-op department, post-operation department. Convenient access to elevators is very essential. Okay, adjacent to elevators, the big elevators. Okay. Orientation, northern orientation of operation theater is considered to be the most suitable, and to ensure adequate daylight within the theater and to avoid any glare. Okay, so a northern orientation is best because like north, south, west, east, west direction. Okay, place your OT in the northern direction. Okay, whichever is the north part of your hospital, place your OT in the north direction because it will not get any glares. If it is in east, you have to face the rising sun. So there is lot of heat that comes into the OT because of the rising sun, and there is a lot of glare, okay, of the sun as well. If it is in the west, the setting sun will give you the glare. If it is in the north, it's a good direction. Factors determining the total number of operation theaters. First is the type of the hospital. What kind of the hospital you have? What specialty of hospital you have? Okay, cardiac. Is it a general hospital? If it is a general hospital, the number of operation theater should be much higher. Specialty hospitals will require lower number of operation theaters. Hospital bed complements. The more the number of beds you have in a hospital, more OTs you will require. Okay. Usually 1% of the total bed structure should be the OT for, like, for example, for 1% or 2%, something like that. Okay, that is the percentage value. For every 100 bed, 2 OT should be available. Okay, so if it is a 1,000-bedded hospital, you will have more than 20 operation theater complexes. Okay. Then number and type of surgical patients. On a daily basis, how many surgical patients you witness in a hospital average. Okay, so that should be considered for any renovation. The number and type of specialties. The more the type of specialties you have within the hospital, more will be the total number of operation theaters. More the number of surgeons as well. More surgeons, more OTs will be required. Number of operation days, the number of days when operations are ongoing, when your OTs are not closed, okay, per year. So based on that also, you have to decide the OT, number of OT. Average length of patient stay in surgical, that also not medical patient, surgical patient. Okay, how long does surgical patients stay in the hospital? Hospital policies. Expected turnover interval in OT. Turnover interval means like how much time you have between two operations. Okay, if it is too less, means if very less amount of time, within very less amount of time, you have to ready your OT for the next patient, which means your turnover time is very less. Okay, so you will require more OT complex. Average size of the OT list, clearing time for the OT between the surgery. If the cleaning time between surgeries is too long, have more number of OTs. Allowance for emergency surgeries, always keep 1 or 2 OTs empty, okay, without any work to accommodate any emergency surgery. Allowance for septic cases as well. Allowance for staff breaks. Okay, so based on these data, you will determine the total number of operation theaters. Majorly, if it is a 300-bedded hospital, 3 OT will be required. 500 bedded hospital, 5 OT, 750, 8 OT. Okay, always take the upper limit. It's a 1,000 bedded hospital, 10 OTs will be required. But given the statistics in India, okay, based on the Indian population that we are seeing right now, these data are old. Okay, now if it is a 300 bedded hospital, you may require at least 5 OT. Okay, so the number of OTs have increased to cater to the big population that we have in India. So size of the OT, size of the operating room, size will depend upon the surgical facilities. So general operation room around 40 square meter should be the size of a general operation room. Okay. If it is based on specialties, okay, like cardiovascular OT, neuro OT, ortho OT, the size will increase. Okay. Am I audible to all? If you have any queries, directly put in the chat box. Okay, I'll reply to it. So when you come to specialty kind of services like cardiovascular OT, neuro OT, ortho OT, okay, you will have you should consider more space, at least 20 square meter more additional adjoining room because required for heart and lung machine. Okay. Endoscopy suite, it's a very small suite. Okay, very small place you require, just 20 square meter. You can construct a endoscopy room. Okay. For 200 to 300 bedded district hospital, optimum size of an OT should be around 18 feet by 18 feet by 18 by 18 to 18 by 20. Not more than 400 square feet is required. Next, zoning of OT. OTs also have different zones, okay? 4 different zones. The first zone is protective zone. So in this zone, this is the entrance of the OT, okay? Main facilities which you see in the protective zone, the zone 1 is patient's waiting area and reception desk. As I mentioned, every OT has its reception desk. So reception area, reception desk area, and the patient's waiting area where patients will have to wait to be called inside. Okay. And they will be placed here. Trolley bay where stretchers and wheelchairs will be put. Lifts and staircases, switch rooms, pre-anesthesia room, changing room, store room can be put in the protective zone. Next, we have the clean zone. It provides pre-operative room where a pre-operative examination can be done. A recovery room after the operation. Patients can be kept here for monitoring them during the recovery. Theater work room, cleaning the instruments, decontamination. Okay. X-ray room, plaster room, the nurses room, scrub nurses room, staff nurses room, anesthesiologist store room. Okay. This can come in the clean zone. Limited access, not everyone, public cannot access these areas. Then you have the sterile zone. This is where the operation will be conducted. Okay. Only the medical staffs will be allowed here, scrub room, anesthesia room, instruments, trolley area. Okay, in this zone, operation suite will be also available. So in sterile zone, It's a limited access zone, only skilled staffs, whoever is taking part in the OT operation, only they will be allowed here. Then we have the disposal zone. In disposal zone, uh, whatever was used up in the operation, which has to be disposed, all the biomedical waste and everything, okay, that will be collected and stored here. Okay, dirty room, disposal corridor, janitor's corridor, they all come under the disposal zone. So they will take care of the housekeeping and the cleanliness, the sterility, okay, the biomedical waste management, that will be taken care in the disposal area. So staffing in the OT, surgeons, anesthesiologists, nurses, technicians, attendants of OT. Okay, so these all are the major staffing used in OT. Policies and procedures. So in administration of the OT should work in a proper scheduled timing. Okay, do not cancel the operations as much as possible. Make sure you are not canceling any operations. Okay, OT scheduling also, it is done properly. Punctuality, when 9 a.m. the OT has to start operating, and it should be functional. The OT has to be functional. Train the staff, okay, in OT also. If it is a medical college, am I audible to all? If it is a medical college, you will have to train your staff as well. Operating list should be prepared. What all equipments are required, what all equipments or articles required, what requires maintenance, broken articles, etc. They are an operating list should be available. What all has to be checked on a daily basis. Certain electrical appliances which has to be checked for its if it is in working condition or not on a daily basis. So this list has to be prepared. Monitoring of dirty cases. All the dirty or the septic cases should be operated at the end of the day when it is the closing time of the OT. Okay, all the dirty cases should be taken care of at the end of the day. Monitoring of asepsis, checking that that there is no cross infection taking place. Staffs are safe. The patients who are admitted in the OT, they are also safe. So that monitoring has to be done. Fogging, fumigation is not done these days. Usually it is fogging that is taken care of. So fogging equipment and AC, if you have an air conditioner, make sure you turn it off 10 minutes before fogging starts, and it is put on after 1 hour of fogging. So give the time for fogging to do its work. Fumigation is not done usually. Now it is just fogging that is done. 2% of bacillocid solution can also be used for fogging. Formaldehyde is no longer used for fumigation or fogging. So this was about OT. If you have any queries, you can mention in the chat box.